The patient-centered healthcare team in Tromsø and Harstad have been fortunate to join the RemoAge project, and we bought in 6 iPads to start with, and have been testing these out for about 25 patients so far. The team is a multidisciplinary team with nurses, doctor, pharmacists and physical therapists, and they have been testing out different ways of using the iPads. Some have been able to leave the iPad at home at the patient, and the patient is able to have contact with the doctor at the hospital or the nurses for a period of time after newly released from the hospital.
Across Shetland, in partnership with NHS Shetland and the Shetland Islands Council, our RemoAge project is about embracing really the communities that are there and the digital technology we need to use to support them. And primarily we want to look at how we support the communities and those in receipt of services in tandem to join the two together. We want to use digital technology as a bridge and as a platform to do that. And through the use of technology and by increasing the deficient connectability across the islands, we feel that we can actually bring together families, communities and third sector workers alongside with health and social care to provide a network of virtual care communities.
The first is building on some of the earlier work we did with RemoDem, the precursor to RemoAge, which is around our dementia-friendly communities. So building the work that we did then and supporting businesses and organisations in our community to make their environments a bit more friendly to dementia patients and their carers. So we're doing a bit more work around that. Other things we're doing include testing out a social prescribing scheme. It's really looking at tackling social isolation, which is a big challenge for up in the Western Isles, a very remote part of Scotland. The third area which we're testing out is our work with technology. So we are developing an assisted daily living centre. We had the launch for that in Stornoway, our main town, just a few weeks ago, and we had over 80 people turned up showing an interest, so they get a chance to test out the technology.
Our background is in the application of technology to healthcare problems, and I'm particularly interested in the project because it's dealing with some of the rural populations that we would have in Northern Ireland, and even today I've heard of stories from other partners in the project that have been dealing or coming up against the same issues that we've been dealing with for 5 or 6 years now with internet connectivity, and it'd be really interesting to find out how we can overcome these barriers. A lot of the apps that we've been producing in Ulster over the last 10 years I think will fit very well into bringing this new area of care for these rural populations that we'll be dealing with.
RemoAge project in Norrbotten, we have 4 municipalities and healthcare involved. And the test the community and the healthcare center are doing is remote consulting between doctor and healthcare center and nursing in the nursing home. We also have remote consulting between nurse in home care and assistance nurse in nursing home and supervisions. We also have test a digital medicine dispenser, even those, and this test is now evaluations and finish.
We have 2 jobs in the RemoAge project. The first one is concerned with evaluating the work, and the second one is concerned with transnational learning. So in the evaluation, our main interest is the people who are supposed to benefit from the RemoAge project, which is frail older people living in rural areas in the northern periphery. So we're collecting data from all the sites about who's involved in receiving the services, what they think about them, and most importantly, what difference they make. On the transnational learning side, we're looking at the ways in which each of the sites can learn lessons from one another. So we're talking to them about their own experiences, and we're asking them to compare what they've learned, what difficulties they've faced, what went well, what went less well with one another, and therefore to help them improve what they do next.